Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain Free with Dr. Marc Darrow from the Darrow Stem Cell Institute in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified in physical medicine and rehabilitation. He teaches about the use of prolotherapy, PRP, and stem cells. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Nita Valens.
Hi there, Dr. Darrow. How are you?
Hello, Anita Valens. I'm doing well. How about you? I'm living it up.
I'm great. I'm living it up also.
Good.
So what do you think about our listeners coming out of their chronic pain and living it up?
Well, I think regenerative medicine is the way to go. Surgery certainly has been proven to cause a lot of side effects that people don't want to live with. I'm one of them. As everybody who listens to my show knows, I had a shoulder surgery during medical school in another lifetime, and it came out bad, and that taught me the lesson. Then I learned about regenerative medicine using platelets and stem cells, and with one treatment to myself, I injected my own shoulder. I woke up the next morning after 4 years of misery after the surgery and was completely healed. That's not the way it always goes. I'm not trying to make it out like this is a panacea for healing. It's not. But regenerative medicine with platelets and stem cells works great with properly chosen patients and properly chosen doctors. That means you got to be careful who you use as a doctor, because a lot of guys do this, really have no idea what they're doing. And I'm going to give out the phone number because I heard you breathe. That's my key.
Yes, I do that once in a while.
So if you want to talk to me right now on the radio and find out about musculoskeletal pain and how to heal it, anything from the top of the head to the bottom of the feet, I inject. And I use your platelets or stem cells. And to call me right now, please get a pencil and paper. The phone number is 866-870-5752. That's 866-870-5752. And then if you are shy, I hope you're not. We love talking to callers. It's much more exciting than just Nita and I talking to each other, because we've been doing this. How many years, Nita?
We're in our 13th year.
All right. And I've been doing the show for, I think, over 20 years. I've got 21-year-old twins, Jordan and Brittany, the beautiful girls of my life. And I started the show way, way back then when they were little teeny babies. And it's been a great show ever since. I love educating people, and I love being a maverick. And the maverick part is I started doing this when I was one of the only guys really in the country doing it. And I was scoffed at because no one believed in it. So we're moving ahead. It's a slow process of getting other doctors involved. But now if you look up stem cells on Google, you'll see there's lots of doctors doing it. The unfortunate thing is most of them really don't have much training in what they do and don't do that much of it. And I wouldn't go to an orthopedic surgeon to get regenerative medicine, platelets or stem cells, because they don't really believe in it. They believe in surgery, and I was trained in surgery during medical school, my internship, and during my residency at UCLA. And I loved it, but I don't think it's the way to go for most cases. Obviously, if you have a broken bone or an emergency, then you need to get to the orthopedic surgeon or neurosurgeon right away and have that taken care of. But most musculoskeletal issues that I see, although the people come in saying they have to get surgery, when I examine them, I find out they really don't need the surgery, and most of them we can get healed by just doing injections, very simple injections. I love it. They walk in the office, they get injected, and they walk out. But they say, do I need someone to drive me? Nope. Are you going to put me to sleep? Nope. Are there going to be side effects? Typically, there's very, very few side effects. The main side effect is people get a little bit stiff afterwards for a day or so. But they're relatively very safe, especially compared to a surgery. And I get people, I'm going to say it the way it is. It gets me angry because I get people come in the office every day who have had failed surgeries. And failed surgery means they had a surgery, the doctor said they're going to be great afterwards, and they come out worse. And actually, I have a question here until we get some callers.
Could I just say one quick thing?
Yeah.
For people that are new to this concept, you really want to call, because we're giving the free book, Dr. Darrow's latest book, we're giving away for free, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. It's an opportunity for you to look over the 264 scientific studies in the book and really understand what this is before you come in. But you want to call us right now and get your free book at 866-870-5752. At least do that. But you can talk to Dr. Darrow. It's like a free consultation almost on the radio.
You know what's so funny? People that have been healed by this tell their friends who are injured, and it's like pulling teeth to get people to come in because no one believes in it. Everybody has the culture of surgery in our country. And it's a shame because most of these surgeries should not be done. There's studies in my book that show the failure rates, and it's a high failure rate. I'd say probably in my experience about 50%. And I've seen a lot of terrible things happen to people who have had these surgeries done. I'm going to actually go to a question, Nita, if you don't mind right now.
Okay.
Or you have something else. You sound like you have other issues you want to talk about.
Oh, no, I just wanted to see if you wanted to talk to Cody in Valencia.
Well, of course, I don't want to keep Cody waiting. Cody, how are you? Dr. Marc Darrow.
Hi, I had a question. I was diagnosed about 10 years ago with a grade 2-3 separated shoulder from a softball accident where I dove for a ball. And right now it keeps aching and like popping out of joint, or separating, and the part on the top will stick up high in the morning, and it'll kind of come back lower in the evening. But is that something that you kind of have to have surgery with? I tried physical therapy like 10 years ago, but is there anything else that you can do for that? Or
well, I've had people with that, and it depends on how mobile that joint is. It's the acromioclavicular joint. And all you folks listening, if you go to Google and just type in these words that you hear me say that are medical terms, if you go to the upper left-hand corner, you'll see a little area where you can click on that says images, and you can actually see what these images are. You can see the anatomy. So it's a good way, and also for you, Cody, you can do this too. I think you probably, after all these years, know what it looks like, know what the anatomy is. But the clavicle attaches to the top of the shoulder, which is called the acromion. And it's a teeny-weeny little joint. And that joint can be separated with a fall. Often it's the ones I see the most are people that go over the handlebars of their bicycle. But it can happen for other reasons too. I've had very good luck using stem cells and platelets in tightening those up, but I'd have to see it. I always tell people the diagnosis means nothing to me. Most people that come in have the wrong diagnosis. So I need to actually touch it, do an examination to find out what's really going on. And I get emails from people all over the world saying, let me send you my MRI or X-ray or CT scan and then tell me if I'm a good candidate. Those images don't tell me a darn thing. And they may not even be the pain generator. So I'd say, Cody, if you want to come into the office, write this down. I'm going to give you a phone number. It's 800-300-9300. That's 800-300-9300. And you can get more information there that we don't talk about on the radio. And we'll see if you're a good candidate. But I only know if you're a good candidate if I can touch it and move it and see where the pain is coming from and actually see how mobile that joint is. There was a similar one that I had a few years ago of a golfer who was going pro, young guy, and he had the same thing but in the sternum, where the sternum connects to the clavicle. So there's two areas of insertion of that clavicle. One is at the acromion, which you have, and the other one is at the sternum, right in the center of the chest bone. And his was mobile, and he had to stop playing golf. It was a catastrophe for him and his family because they put their whole life into his golf game. And his dad caddied for him his whole life, ready to go pro, had to stop because of the hypermobility of that joint. And we had to work on that for a while. I'm just going to be really honest. It wasn't a quick fix. But he's back out on the tour now, and he's playing golf again. And the reason I say it was a slow heal was because when you have a joint that's very mobile like that, it's harder to tack it down again unless you do surgery. But most people don't want to do surgery for that type of an injury. If it was really very mobile, where that clavicle was falling out of place, then I would say surgery is definitely the way to handle it. But yours sounds like it's something that we might be able to heal by using your stem cells or platelets. So I'd have to see it, have to move you around and check it out. Does that make sense, Cody?
Yes.
Okay. So again, I'm going to give out the phone number to the office. Anyone wants to get a hold of us there. And there are people usually by the phones ready to answer questions, even now. And the phone number there is 800-300-9300. And for those of you that want to talk to me live like Cody is doing right now, you can call the radio studio at 866-870-5752. I'll repeat it once more, 866-870-5752. Cody, do you have any other questions about this process or how we do it or what your chances are for success or anything else?
No, that was the basics. I appreciate it.
Okay. Very cool. I appreciate your call, and God bless you and your healing. I think you're going to heal up. Yeah.
Thank you.
Thank you, Cody. You want to give the phone number again?
Well, it's my favorite thing, talking to people. If you
hear
want to call me right now or badger Nita a little bit, the phone number to talk to us live is 866-870-5752. And if you do call in, I'm going to send you a copy of my book about platelets and stem cells. It's called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. I'm showing it to the camera right now. We'll send it out to you for free. And Suzanne Summers, the famous actress and advocate of natural medicine, wrote the foreword to the book. And she also wrote a chapter of me. I'm showing this to the camera right now. She has a book called A New Way to Age, and she dedicated a chapter on it on page 302 that says Interview with Dr. Marc Darrow. And it's all about my work and regenerative medicine. And it's a pretty bulky chapter. It goes on to page 316. So Suzanne Summers, God bless you. Thank you so much. And I appreciate all of the sacrifice and work you do in your life to help people heal naturally. It's the best way to do it, obviously. I always tell my patients, they say, who can you refer to me, what doctor for kidney disease, for heart disease, for whatever it is, or if I want to get a surgery. And I tell them, I'm going to send you to someone that I know who does the most, because those are the people that have seen the worst incidences and know how to get people out of them. And that's what I tell them about regenerative medicine. If they don't want to see me, you've got to vet the doctor. You've got to find out who does the most. I think I do the most, but if you don't like me, make sure you interview your doctor and make sure you find out that that doctor is doing this all day long, every day. So that doctor knows the most about how to heal you and how to get you back in the game. So, Nita, if you don't mind, I'm going to go to Mike in Norwalk. He's got low back pain, and that's something that 80% of people get at some point in their life. So I think he's a good guy to talk to.
Good call.
Hey, Mike, Dr. Marc Darrow, can you hear me okay?
Yeah, I can hear you.
Great. So I understand you have low back pain. How long has that been going on?
3 years. First, like 3 years ago, when I really came on, I never had low back pain my entire life. I'm 55 years old.
Okay.
And I've had pulled muscles in the mid and upper back from lifting weights and stuff.
Sure.
It never really bothered me, but I never had low back pain.
Okay.
About 3 years ago, I came down with it, And it made life just miserable.
Yep, I've been there. I've had it. And I've injected myself and had other people inject my low back. Actually, I've had my entire spine and all of my ribs injected also. I'm not what you'd call a bodybuilder, but I do a lot of sports. I was a gymnast, and I've done
that's
every.
My problem. I like to be active too, and it just kind of messed me all up. The thing about my back problem is at least if I'm sitting down or if I'm laying down in bed, it pretty much goes away entirely almost.
That's
when
good.
I'm standing or doing things upright, that I just can't hardly do nothing. I used to go for long walks, and I can't even do that no more.
Okay. Let me ask you some questions. Let me ask you some questions.
I tried the physical therapy. That made it worse. That made it to where now I wasn't even having relief when I sat down or laid in bed. It was getting so bad. So I finished with that, and then the last thing I've just done is have injections in the back, the lower back. It was like 8 or 10 injections from I don't know, some type of epidural, or I don't know what it was.
Okay.
They explained it to me, but that didn't help either. It was really hurting. This was about a week and a half ago, and it was kind of off and on.
That's all good news. Mike, you got to listen for a second. I hear your story.
Sorry, I didn't hear you trying to speak.
Okay, no, it's okay, no problem. So do you have any pain down your legs?
No, I don't really have pain down my leg, but the pain is like at the very base of my back to where even say like the top of my butt, like. Okay,
so that's good. Everything you're telling me, Mike. Everything you're telling, Mike, you got to listen too. It's a two-way deal here.
I'm sorry. I didn't mean to talk over you. I actually couldn't hear you.
Okay.
I'll be quiet from now on.
No, you don't have to be quiet from now on, but I gotta give you some information.
Yeah. That's what I want.
Okay. So number one, it sounds like you have a few sprains in there. One is the iliolumbar ligaments. So look that up on Google and go click on the left side at the top, and you'll see what they look like anatomically. The other thing is the quadratus lumborum muscle attaches on the pelvis there. And then there's another sheath of collagen that's called the thoracodorsofascia that attaches there. So those spots you're talking about are very ripe for a sprain. A sprain means the tissue is very mildly separated, microscopically. It's like if you have an ankle sprain. Have you ever sprained an ankle, Mike?
Yeah, I have sprained an ankle before.
Right, and it hurts like heck, but it's not a big deal. And this thing in your low back is not a big deal either. And it's very easy to heal. I would probably use platelets, and if you wanted to heal it super fast, add stem cells to the mix. And
can I ask you if this matters? I
Sure.
did have an MRI, and I know how you feel about those. I like what you talk about, how hands-on and feeling. Because none of these guys ever even bother when I point out where it hurts. They never even bother feeling there. And I'd like to use that's one of the things you do.
Well, what did your MRI say?
But on the MRI, it showed that I had 4 problem discs and spondylolisthesis.
Okay.
Just a grade 1.
Yeah.
Would that affect any of that in your treatment?
No, those things don't count.
Okay,
That's what I'm talking about. That's what I talk about on every show.
Schedule an appointment?
Yeah. Well, let me talk about this first. Okay?
Right.
So problem discs don't mean anything. Okay?
Mm-hmm.
And spondylolisthesis grade 1 means nothing at all. Nothing. If it's a grade 4 and one vertebrae has slipped off the other, that's a problem because the spinal cord is going to get stretched there, but you don't have anything like that. So I see patients with spondylolisthesis almost every single day that don't have a problem because of that. I see people every day who have, quote, problematic discs, like bulging discs, or sometimes herniated discs, where there's no problem at all. You already told me you don't have any leg pain, so the nerves are not being impinged. You just most likely have a sprain in your back. So the other thing I didn't mention is there are ligaments also between the vertebrae, and those may be sprained also along with the iliolumbar ligaments and the other things that I mentioned. And those generally heal up very quickly. Back pain goes away very quickly, neck pain, thoracic pain, all of those things. But again, I don't talk anything about what's going to happen to you on the radio. I have to examine you.
I understand.
Yeah.
Are you actually the guy that does the evaluation, you yourself?
Yes, I do the whole thing.
Okay, I like that. Yeah, I've been listening to you for a long, long time on the radio.
Wonderful. Well, thank you so much, Mike. I appreciate that.
But my wife, she believes more in traditional stuff, and so I've been trying everything she said, just so like I said, okay,
well,
I tried it.
The main thing is you're fine. It's not the worst thing in the world. It's a nuisance. It's healable. But just one thing, one word of wisdom from what you just told me. Never have surgery for those things, okay?
Yeah. I wasn't about to do that.
Okay.
No matter how bad it got, I wasn't about to do that. I was in some kind of accident, unconscious, and they just did it or something. Because, I know a friend has had back surgery, and it wasn't too many years, and he had to have another one.
Yeah. Well, I just got an email this morning from someone, and I'm going to read it to you. It says, I'm seeking relief from severe back pain, status post failed back surgery. Status post means afterwards. So he had a back surgery, and now the person is worse. Okay? So I get those patients in my office all the time, and you don't want to be one of them. Most back surgeries, most back surgeries that I have seen, obviously people come to me when they're not feeling good, not the ones that did well, because there's a lot of back surgeries that are needed. But most of them that I see shouldn't have had it done. So we have to be very careful. And you need to get a second opinion or a third opinion from another doctor if someone says you need surgery, unless it's an emergency, of course. And the problem is, don't go to the same kind of doctor because they're all raised in the same tradition and the same culture. You've got to go to somebody else and a different type of doctor.
I'm not going to go anywhere else. I'm going to come down there and have you look at it.
Well, bring your wife with you.
All right, yeah, all right. Hey, I was surprised how easy I got on.
Well, you're a good man.
Get on. I just called the first time, but I got on. I'm a lucky guy, I guess. Meant to be.
Well, God bless you, Mike. And
okay, you too. I'm going to get a call to your office, and I'll.
All right. Thank you so much. Yeah, I mean, in my experience, healing your back, there's about an 80% shot at doing that. Okay, so you're very high on the list of healing.
Sometimes you just wake up, and from the time you get out of bed, it's just almost wants to make it. You almost feel like crying, like you just get so depressed. Like, is this it forever now?
Well, I was there. I was worried for a while. I had it, and I injected it. It's better.
I tell a lot of people, and you were right about how these surgeons they believe that that's the worst. I brought it up to one of the doctors. He was an orthopedic surgeon. And I just happened to mention it, see what he thought. Oh, no, that stuff, no. I said, okay. I didn't say no more because I knew he just believes what he was taught, and that's all he knows.
Well, look, I love surgeons. They do the hardest work in medicine. But I don't like the surgeries that they do.
Yeah, some of them. I have had a surgery, but it was on an elbow that I tore the tendon away from the bone.
Well, you need a surgery for that then, yeah.
I needed one for that,
Yeah. So here's another one. I just got this email also this morning. Let me give out the phone number first, but hang with me. The phone number for other callers right now live, 866-870-5752, 866-870-5752. This is Dr. Marc Darrow. I am talking about stem cell and platelet therapy. We call it regenerative medicine. Here is another email. I get emails all day, all night long from all over the world from my website, which is www.lastemcells.com, www.lastemcells.com. And there's a spot on every page where you can email me if you're too shy to call the show, but I'd rather you call the show. Anyway, here's the email. I slipped and fell a week ago, front foot forward into splits, and apparently have an 80% hamstring tear avulsion. Does your PRP stem cell therapy treat this kind of issue? That's another one I have to do an examination. I have had people with complete tears that I've healed up, but if it's a massive tear and there's no connection at all, and it's flapping in the breeze, then you need surgery. So a lot of these tears, even though it says it's 80% or whatever percent, the tissue can still be very good. And you don't need to, it's not separated, and you don't need to actually have a surgery. It's just something I have to examine.
You have to check it out,
Yeah, I had a plastic surgeon come in. Oh, we're going to the break. Stick with us. Dr. Marc Darrow, Living Pain Free. We're talking about stem cells and platelet therapy. The number to the show to call us right now is 866-870-5752. My office number is 800-300-9300.
And we'll be right back.
You're listening to Living Pain-Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.